Today's topic is professional standards in nursing. Just to let you know, guys, we are preparing NClex by Saundersbiok, and it is really important for you guys, those they are going for NClex and those they are on NClex journey. Do read Saundersbiok word by word. It is my really honest tip and really boring as well. That's why I'm just reading here. If you want to wish to understand, if you want to listen, then you are very welcome. I know there are hundreds, I don't know how many channels there are available, how many people there are available. They are trying to explain you, they are making our lives easy for NClex students. I'm just reading here what I have done. I'm just doing my a small tips and tricks. Hopefully it will be helpful, and I know, guys, at the end you would say that it is helpful, because when you are going to read and you are going to listen every word of this book, then you might be, if you have skipped something, and because there are people, they are concising the chapter, summarizing, because it is um, impossible to read everything, every word. But I would say, if you are cooking, if you are doing anything, if you are driving something, on your journey, you are going somewhere, then do listen these chapters. It will be helpful, because listening sometime it helps. Okay, so we are going to start unit number 2, professional standards in nursing. They do have professional standards in nursing, everyone have, but we are reading about USA. So pyramid to success, as I have told you guys, these pyramid bullets are very important, and we have to read, because it is going to be tested in NClex exam. So pyramid to success. Nurses often care for clients who come from ethnic, cultural, or religious backgrounds that are different from their own. Nurses are also in a primary and unique position to address the individualized needs and care for various population groups. Awareness of and sensitivity to the unique health and illness beliefs and practices of people of various population groups are essential for the delivery of safe and effective care. Acknowledgement and acceptance of personal, cultural, religious, and spiritual differences with a non judgmental attitude are required for providing culturally competent and sensitive care. The NClex RN test plan includes information about recognizing a client's personal and cultural beliefs as integral to patient care quality. The nurse needs to avoid stereotyping and needs to be aware that there are several population groups, subcultures within cultures, and there are several dialects within languages. In nursing practice, the nurse needs to assess the client's perceived needs before planning and implementing a plan of care. I'm sorry, guys, if I have a little bit pronunciation problem. English is not my first language. I apologize for that, but we are reading all of us together, so you can just digest these all words. Across all settings in the practice of nursing, nurses frequently are confronted with ethical and legal issues related to client care. The professional nurse has the responsibility to be aware of the ethical principles, laws, and guidelines related to providing safe and quality care to clients. In the pyramid to success, focus on ethical practices, the Nurse Practice Act, and rights of all clients, particularly confidentiality, information security, and informed consent, advocacy, documentation, and advance directives, and cultural, religious, and spiritual issues, knowledgeable use of information and technology such as an electronic health record is also an important aspect of the role of the nurse. The National Council of State Board of Nursing (NCSBN) defines management of care as the nurse directing nursing care to enhance the care delivery setting to protect the client and healthcare personnel as described in the NClex RN exam test plan. A professional nurse needs to provide integrated, cost effective care to clients by coordinating, supervising, and collaborating or consulting with members of the interprofessional healthcare team. A primary pyramid point focus on the skills required to prioritize client care activities. Pyramid points also focus on concept of leadership and management, the process of delegation, emergency response planning, and triaging clients. Look here. So what is this mentioning? Just we have to respect all the religion, all the beliefs, and we don't have to be judgmental as a nurse, and we have to provide safe and effective care environment. This is the actually summary of this paragraph, and it is a pyramid of success. So do we have to read this? Let's go. Client needs, learning outcomes. Look here again, this pyramid of success. Everybody will look at this bullet. We have to read and we have to understand. I'm going to read, or maybe somewhere I will explain a little bit. Let's go and read. Client needs, learning outcomes. Safe and effective care environment. You will see a lot of safe and effective care environment in this book. Acting as a client advocate. As a nurse, you have to act as a client advocate, becoming familiar with the emergency response plan, collaborating with interprofessional teams, delegating client care activities, and providing continuity of care. You are nurses, and I believe you are working in hospital settings, different hospital settings. So I would say just you what you have to do here. Look, you have to be client advocate, and they are saying you have to respond to emergency. If something happen, you have to respond for that. You have to be a leader, and sometimes you need to delegate clients. Ensuring ethical practices are implementing everywhere. Every country has ethic code of ethics of nurses, so you have to practice ethical codes. Ensuring informed consent has been obtained. Whatever you are going to do, what procedure you are going to do, it is must that you have to obtain the consent. Ensuring legal rights and responsibilities are maintained, establishing priorities related to client needs and client care activities, instituting quality improvement procedures, integrating advanced directive into the plan of care. What is advanced directive? I would mention a little bit about advanced directive, those they don't know. It is kind of will that you maybe you want CPR or not, you want to be resuscitate yourself or not. Sometime the patient will decide, and sometime relatives, and we will have further detail about advanced directives in further chapters. Integrating case management concepts, maintaining confidentiality and information security is issues related to the client's healthcare. Recognizing cues that indicate a safety issue. If you go my previous videos, I have recognized these cues. I have talked about that and I described the table. Supervising the delivery of client care, triaging clients, upholding the rights of all clients, using information technology is a confidential manner, using leadership management skills effectively. Let's guys, we have read about client needs. We are reading client needs and safe effective care environment. We have read it. Now health promotion and maintenance. So we are going to read health promotion and maintenance, considering cultural, religious and spiritual issues related to family systems and family planning, considering personal viewpoints and individualized health care needs of population groups, generating solution in the plan of care that address the client's preference and lifestyle choices. I'm sorry for that noise. So identifying high risk behaviors of the client, performing physical assessment techniques, promoting health and preventing disease, promoting the client's ability to perform self-care, providing health screening and health promotion programs, recognizing cues indicating a risk for a health problem, respecting client preference and lifestyle choices, Psychosocial integrity. Now we are going to read about psychosocial integrity. These, categories and subcategories I have already explained in my video. If you have seen, just go back and look at my channel, you will find it. Psychosocial integrity, addressing needs based on the client's preference and beliefs, assessing the use of effective coping mechanisms, becoming aware of personal, cultural, religious, and spiritual preference, and incorporating these preferences when planning and implementing care. Identifying clients who do not speak or understand English and determining how language needs will be met by the use of agency approved interpreters. Again, identifying family dynamics as they relate to the client, identifying support system for the client, providing a therapeutic environment and building a relationship based on trust, recognizing cues that indicate abuse or neglect issues, physiological integrity. So, analyzing cues when monitoring for alterations in body systems or unexpected response to therapy, evaluating outcomes of care, generating solutions or providing nutrition and oral hydration, considering client preference, implementing therapeutic procedure, considering individual preferences. So, prioritizing hypotheses regarding client preference for providing holistic client care. So, this is the physiological integrity. Actually, we have to provide everything. We have to soothe the patient. We have to take care of the patient by all ethics and by all morale and act and behavior, good behavior, everything. Providing non-pharmacological comfort interventions, taking action to ensure that emergencies are handled using a prioritization procedure. So, guys, we are reading unit number 2, professional standard in nursing. So, we have read about health promotion and maintenance, we have read safe and effective care environment, the category of psychosocial integrity, physiological integrity. Now move on. My goodness, this is the chapter unit 2. This is the unit 2, very small. We have read about that. Now we are going to start chapter number 5, population health nursing. I have uploaded question, answers, and rationals of this topic, chapter number 5, in my channel. Hopefully, you guys will see after reading this chapter. Might be if you could have time, or maybe later on. Those they are new people, those they are just started the training of NClex, and those they are just thinking to and planning to prepare NClex. Just go for that first chapter number 5, population health nursing. You read word to word and then go back to that question, answer, and rationals video, and questions, answer, and rationals are available on my channel as well. So let's guys, we read, we do not spend or waste time here. Population groups. A. For this chapter, based on the literature, the authors have identified certain population groups most commonly cared for in the healthcare environment that require nursing, special attention, care, and sensitivity regarding their healthcare needs to ensure that their needs are met. Again, we have this pyramid to success, which is very important, and we have to read this and we have to understand. So I'm going to read slowly, guys. You would understand this. Healthcare disparities. I'm not using very academic. My accent is neutral, and might be pronunciation is a little bit different, and it is hard for understand for some people, but I apologize for that. Again, we are going to read healthcare disparities. Healthcare disparities are differences in healthcare offered to different groups of people. B. Some of the vulnerable groups that are at risk for health disparities include minority groups, those who are insured, uninsured, those who live in poverty or who are homeless, those with chronic health problems and disabilities, immigrants, refugees, those with limited English proficiency, those who are incarcerated, and members of LGBTQIA. This is everybody knows community. So here I would just a little bit explain about this B option. B, this is just saying those because we are preparing NClex RN for USA and it is talking about USA. Some people are homeless there, some they are living in poverty, some are immigrants, refugees. So they are talking about these vulnerable groups. So let's go. Number C. Vulnerable groups experience greater risk factors, a lack of necessary access of care, and increased morbidity and mortality as compared with the general population. Vulnerable populations in healthcare, then they have one reference here is about American Journal of Managed Care. They have given the website and this is here you guys see. So we are going for D. Nurses often care for clients who are vulnerable and at risk for healthcare disparities. Nurses need to be aware that healthcare disparities exist and plan and provide care to prevent a disparity. Number E, nurses are also need to be aware of the most prevalent chronic health problems and infectious diseases in the United States and their associated risk factors. This is important because when performing assessment, nurse need to screen for these health problems and infections and their associated risk factors and to determine necessary protective measures and support services for the individual or family. Then the nurse needs to plan appropriate educational strategies and teach about the measures that will either prevent or treat these health problems and infectious diseases and connect the client or family with identified support services as it is mentioned in box 5.1. That box is I am explaining in my small videos. You can go for that. Here I will mention again. So let's go nursing assessment. See box 5.3. Chronic health problem in the USA and health factors. Chronic health problems are heart disease, cancer, lung disease, stroke, Alzheimer's disease, diabetes mellitus, kidney disease. Risk factors: tobacco use, poor nutrition, obesity, lack of physical activity, excessive alcohol use. Then let's go guys, we are going for box 5 number 2, 5.2, common infectious diseases in the US, COVID-19, coronavirus, sexually transmitted disease. Then they have mentioned here some diseases: influenza, staphylococcus aureus, Escherichia coli, E. coli, usually I say E. coli here, herpes simplex, shingles, norovirus, salmonella, pneumonia, hepatitis C. So again, this tool 5.1, they are saying this tool can be used to obtain information from the client about their needs in order to plan care. It can be adopted based on the individual or family group being cared for. The initial healthcare visit and every visit thereafter need to be done with a non-judgmental, non-threatening approach. Number C, the nurse need to focus on reported symptoms first. This will encourage adherence and follow up. Again, see, I'm going to read again. The nurse needs to focus on reported symptoms first. This will encourage adherence and follow up. Subsequent care should include health maintenance, attention to common problems and concern, and establishing an emergency contact person if available. Nurse self-awareness of their own culture, values, beliefs, ethics, personality, and communication style helps to promote optimal health outcome for clients of diverse population. Recognizing one's own basis and being respectful to all people despite differences can influence satisfaction and quality of care. Everybody know that we should respect everyone, every belief, every ethics, kind of every culture. So this is here box 5.3 population health need assessment tool. It is a tool. Okay, here I'm going to mention this. Okay, there are some boxes. So this is box 5.3 population health needs assessment tool. So guys, this box I'm going to explain in next video, part 2 video of this chapter, because it is important, otherwise the video will be very long. So those they wanted to listen, those they wanted to read sounder book word by word, they stay tuned with me, and please do subscribe my channel, like and comment. I would really appreciate for that. So 5.3 we are going to read and in next video. So bye for now. Hopefully you guys will read and listen this all, and maybe you will learn a bit by bit for your exam. It is just only doing all practice questions. It is not going to be helpful, because you have to understand the logic, the concept, the ethics, the groups, population health. You have to understand. You have to understand healthcare disparities. What is it? Nursing assessment. You have to know chronic health problems in the U.S., whether you are living in Nigeria, you are living in India, you are living in Pakistan, you are living in wherever you are living, you have to know these all problems, because you are going to give NClex, you are going to take NClex test, and you should know this all. If every concept will be clear, then it will be easy for you to go and to pass your exam. So we are going to meet with box 5.3 population health need assessment tool in next video. Bye for now. Hopefully it is helpful. Do subscribe, do comment, do like my channel. Bye for now. Bye bye.